erythrocyte sedimentation rate, right? So we did mention earlier that when somebody have acute inflammation, there's release of cytokine, and one of those cytokines is interleukin 6. And this interleukin 6 is going to stimulate the liver to produce acute phase reactant or acute phase protein. And one of them is what? Fibrinogen. And this fibrinogen now is going to coat the red blood cell, and that's going to make them to aggregate into what we call a Rouleau's formation, like a stacks of coins in the venous. And then once they stuck together, that increases their density, because remember we said that the fibrinogen will remove the negative charge on those red blood cells. They will come together and they will become very dense. And once you put them inside a pipette and you're looking at it, so if you put them inside a pipette tube and they watch them falling, because of their increase in density, they're going to fall faster. So they will fall faster in the vertical tube, and that's what we call erythrocyte sedimentation rate. So this is the rate at which the red blood cells settle in a vertical tube over 1 hour, and it's an indirect measure of inflammation. So let's see factors that will increase, factors that are affecting ESR. So what are the factors that increase our ESR? So think of inflammation, right? Infection, cancer, malignancy, right? Because remember, with malignancy, right? So malignancy, infection, inflammation, all this could increase acute phase cytokine. And then the other one is also estrogen, or if somebody is taking oral contraceptive pill. And what's common to both pregnancy and oral contraceptive pill is the estrogen there. So the estrogen from the pregnancy or from the OCP that they are taking, that estrogen normally could stimulate the liver, and that will stimulate the liver to make proteins or clotting factors. And that's why people are taking estrogen or pregnancy. That could increase the risk for very good deep venous thrombosis. So they could develop deep venous thrombosis as a result of that. So because of that estrogen, that will increase production of fibrinogen, and that will increase ESR. And ESR could also be increased in anemia because of the decrease in blood counts. So there's less interference with those red blood cells. So that is also going to make them to fall faster, because the viscosity of the blood is so low. It's just like when you have a water and you are pouring it, it's going to pour really fast. And age and female sex could also have increased. ESR could be increased with age, and a more increase in women than in men. And I think it's related to the with women, it's related to the estrogen. So what I think that could decrease ESR. So things that could decrease ESR includes polycythemia, because of the increased viscosity of the blood. So because of the increased viscosity, that increased the resistance to the flow of blood. So that blood flows slowly, and that's why the ESR will be what? Will be decreased. Also sickle cell. Remember, in sickle cell, because of the abnormal red blood cell, this red blood cell become very sticky. And because they are very sticky, that will also decrease what? The flow in the vertical tube. And the last one is hypofibrinogenemia. So if they have decrease in fibrinogen, that will also decrease the what? ESR. Next question. A 92-year-old man with fever, headache, and jaw claudication with increased ESR. Anybody know what this diagnosis is? Fever, headache, jaw claudication in an elderly with increased ESR. Very good, right? So this patient, I'm suspecting giant cell arteritis, which is also called temporal arteritis. Remember, if you see elderly patient with fever, headache, unilateral headache, jaw claudication, you should be thinking of temporal arteritis. And the first thing you want to do is to check your ESR, because if your ESR is high, you want to start them on what? High dose steroids. So you want to start them on high dose corticosteroid. And the reason why you're doing that is to prevent irreversible blindness, because they could develop blindness and it's going to be irreversible. And then once you've done that, then you send them for temporal artery biopsy. And what you're looking for in the temporal artery biopsy, you're looking for what? Granulomatous inflammation. So that's what you're looking for. And then once you confirm the diagnosis, and of course, you can continue your treatment. And then remember, with temporal arteritis, is also associated with what? Polymyalgia rheumatica. But with polymyalgia rheumatica, the treatment is usually what? A low dose steroid. Even a response to a low dose steroid is actually pathognomonic for polymyalgia rheumatica. But let's see what they're asking us here. Which mechanism best explains the elevated ESR? So the elevated ESR rate, just with acute inflammation, we said that they want to be increasing interleukin 6, and that will stimulate the liver to release what? Fibrinogen. So the best answer there would be B. So increased fibrinogen promoting Rouleau's formation. Next question there. A patient with sepsis has a normal ESR. So ESR is normal, but the CRP is elevated. Which condition explains this finding? So how can somebody who have infection, sepsis, have increased CRP, but the ESR is normal? So we have to think of things that could decrease the ESR, and the answer there would be what? Sickle cell, right?